My name is Amy. I live in Stillwater, Minnesota, and I've got 3 kids. They're all teenagers. My oldest has leukemia. He was diagnosed September of 2023. He went through 9 months of really intense treatment. At the end of that treatment cycle, he didn't have an immune system, which was normal. But you're prone to kind of these crazy infections. They're called opportunistic infections, which you can't get them unless you don't have an immune system. He ended up getting one of the worst fungal infections that all the oncologists, they don't even say the name in the office. It's kind of like Voldemort of Hogwarts. It's like this nasty infection that's really hard to get rid of once you have it, and it can spread to different areas of your body. He had it in his lung. We discovered it middle of June through a blood DNA test. They saw it, but then he quickly needed to move into a surgery and have that lung removed. And that is because the only way to really survive this infection is when they surgically remove the bigger parts of it, and then the medication can start to take hold. Well, we did that. They removed his left lung July 1st, and then a couple of weeks later, it started kind of taking over his right lung, and you need a lung to breathe. So within about a 24-hour window, he became very, very sick, requiring a ton of oxygen, and it became very apparent, well, not really to me, but to all the doctors and the people caring for him in the hospital, that he would need to be intubated very soon. So we had the hard discussion with his doctors that we had to decide, are we okay intubating? If we intubate, he probably won't come off of the oxygen. And they told us the fungal infection had taken over the right lung at this point, and we're out of medical. We've done everything medically that we possibly can. And when the oncologist said that to me, I remember thinking, like a light bulb went on in my head, but I didn't know what I should do with it. It was like medication-wise, we've done everything. Because at this point, surgically, they removed his lung, and then we're treating the fungal infection with medication. And the medication wasn't working. It stopped, his body wasn't responding to the medication anymore. We told Henry, we had a really hard conversation with him along with his oncologist, and he asked her how many days, meaning how many days left do I have? And she said likely 2. And so they kind of let us do whatever we wanted. He entered comfort care or hospice at the hospital. He was too sick to take an ambulance to our house and die at home. So 2 days in, I receive a text from my friend, and she has this light therapy machine that I'm already a little bit familiar with, and she said, do you want me to bring it down? I just heard what's going on with Henry, and I said, I don't know. I was torn because I'm like trying to care for our child and like help him, die peacefully, basically. Like, we didn't want to make him feel like he didn't do enough or he didn't fight hard enough. So I'm glad she persisted. And she said, well, we could just treat the front of his chest, for 5 minutes because he's so critical. And I asked Henry permission, and he said, yeah, that's fine. I said, do you care if we treat your chest with this light therapy for when you're sleeping? And he said he would. So she brought it down at like 1 a.m, and we did 5 minutes, and then we did it the next day, and we continued to do it 2 to 3 times a day. And the first day that we were doing the light therapy, he stopped having a fever. He wasn't septic anymore, and his white blood counts went down into the normal range within 48 hours. So then we had a conversation with the doctors, a different conversation where they were really confused and not totally sure what was happening, but clearly he's doing better. So let's see what happens through the weekend. We'll do another CT on Monday, and we'll see if we need to start talking about treating his leukemia again, you know. And they did a repeat CT on that Monday, and they said, it's not gonna probably look better, but if it doesn't look worse, we're gonna start treating his leukemia. And he's on a track of the living again. They did the CT and they were blown away. It was better.
My name is Jodelle Hunt. I'm an integrative health practitioner and a certified light therapist. My business is Perennial Health, and I work inside of a larger integrative wellness clinic in Sandstone, Minnesota. Henry's story is very awe-inspiring, so I felt just compelled to text Amy the second that I had heard from a mutual friend of ours that he was given just days to live. I just knew that I had to reach out to Amy. We had lost touch just for the summer months because I knew she was deep into caring for him, and I was just giving her space. And so when I decided to text her, this mutual friend was just basically supporting me to do that because I didn't want to be that friend that just comes and does something for you. And so I was encouraged to reach out to Amy, let's put it that way. And I did. And Amy wasn't quite sure if she wanted to go to that level to help. She was very conflicted with his quality of life. He had just a couple days left, and you can imagine what sort of decisions they have to make. And so I just said, well, if it were my son, I would definitely be wanting to do this, and I will be there in a heartbeat if you change your mind, if you want to do this. And then I prayed on that, and she texted me back and she said, Henry wants to give it a try. And so I got in my car, it was 10 o'clock at night, went to the clinic, picked up my Firefly Clinic Pro unit, and drove to the city, which is about a 2-hour drive, and set up the unit. And I think we were administering light on Henry by 1 o'clock in the morning. And so that was really a beautiful thing to be able to help and be a small part of his care team, and just really see that his body responded so well to the light therapy. And I just know that it was because we knew what sort of fungal infection he was battling, and I knew that the Firefly could handle those frequencies and support his body in ablating those pathogens. And I just am so very thankful for having this sort of therapy at my disposal to help other people.
The nurses were definitely blown away. I know one of them really wants to start practicing with a Firefly unit right now. She just was like blown away with how quickly he changed course, and all of the ICU nurses that were in his room at any point and on the hemonc floor, his normal floor, the oncology floor, they all loved the Firefly, talked very highly of it. So yeah, I feel like it was well supported. They do not throw that out lightly. My husband's a nurse, and I asked him, has this ever happened to you where they've been wrong with like, he's gonna die? When they've come to that decision as a team, they meet ahead of time and they are very sure. So I don't think they were wrong. He was dying. I think but we brought in this Firefly and it changed the course of his life. And so that's, for me, it's undeniable. I don't know. I didn't think it was gonna save him, for sure. If I'm gonna be honest, I didn't think anything would, because we were told that nothing would, you know, like he's out of options. And I didn't really think that this light would be that powerful. But now that I know how it works, it makes sense. And his lung tissue needed that energy and the nitric oxide to be stimulated, and everything just worked, and it does make sense to me now. The only thing I cared about is that he felt loved and that he was gonna leave this earth knowing how much we loved him and how much he was surrounded by love, and I didn't want him scared. So I kind of felt like if we kept grasping onto this belief that like he's gonna be a miracle, or he's gonna do, they're wrong, the doctors are wrong, then it would be terrifying for him. And I didn't want him to be scared. I wanted him to see that we were calm and that we were strong and that he's gonna be okay no matter what. And something that I've thought a lot about is if he would have gone in June 1st with a cough, he had a slight fever. That's what he went to the hospital for. When you have leukemia, you have to go into the hospital if you get a fever, because it could be an infection on your port or anything. What I keep thinking about though is if we would have started the Firefly on day 1 of just having some congestion in his chest and he's neutropenic, meaning no immune system, would have we ever needed to remove his lung? I don't think so. I think we would have gotten rid of whatever infection was brewing and we would have gone home. We administered the Firefly light on Henry's lung starting with 5 minutes and increased it to 10 as he got stronger physically. It really doesn't take that much time. I think people have this misconception that you have to treat for longer is better, but because the light is so powerful, it does not make it better if you treat longer. So it's really like a 5 to 10 minutes on his lung, and it feels like a warm light going over it. It doesn't hurt. It doesn't have any adverse, side effects. It just feels honestly like a warm hug. It's kind of calming and like relaxing actually. He is hanging out with his friends. He's driving again. He's very much doing all the normal things a 16-year-old would do.